Assalamualaikum, Madam Ain and all my fellow friends. Today we want to present about non-barbiturate Bezodiapine drugs and suicide. So this is my team member. My name is Rashida Banu, metric number 15. Next, Nizat Akmal, metric number 20. Muhammad Lufi, metric number 17. Nora Anna, metric number 67. Nur Shuhaida, metric number 60. And the last one is Danisha, metric number 3. The index that we include is case study, patient history, pharmacology of Lorazepam, therapeutic usage, pharmacodynamic, adverse effect and side effect, chemical taxonomy, treatment question, and the last one is a conclusion. The case study that we had, a 22-year-old woman brought into the emergency department via ambulance because of suicide attempt. Soon after a night on the town, she called her boyfriend saying that she took a handful of sleeping pills. On examination, she appeared lethargic but grunts and moved all her extremities to painful stimuli. Her blood pressure is 110 per 70 mmHg, heart rate is 80 bpm, and oxygen saturation is 99%. Her pupils are of normal size and reactive to light. Her deep tender reflex are non-barbiturates. In the field, she was given an intravenous bolus of dextrose and ample of naloxone without response. Her boyfriend, with whom she had an argument, bring in the bottle of sleeping medication which said Lorazepam. The question that we had: what is danger of an overdose with class of medication? The second, what is the cellular mechanism of action of this class of medication? And the last one is what pharmacology agent can be used to treat this patient, and what is the mechanism of action?
My name is Nur Shuhaida Asnida. My metric number is 66. Patient story. Age 22 years old. Gender female. Correct condition lethargic. Move all her extremic to pain stimulate. Clinical symptom nil. Pulse 110 mm Hg. Heart rate 18 bpm. Oxygen saturation 99%. Treatment destroyed Naloxone. Drug response no response. Suspected Lorazepam overdose pair. Pharmacology Lorazepam. History of Lorazepam was developed by D.J. Richards, presented and marketed initially by Yates Pharmaceutical in the USA in 1977. The first history FDA label improved in reported in 1985 by the company Mutual Farm. What is Lorazepam? Trade name Ativan, Lorazepam, and Lorazepam. Short acting and rapidly clear benzodiazepine. Normally used as sedative and anxiolytic, analgesic, and anticonvulsant. And muscle relax properties: poor water and lipid solubility, high protein binding, and inactivity metabolic to a pharmacological inactive glucuronide form. The inactive ingredient present are lactose monohydrate, magnesium stearate, microcrystalline cellulose, and pyrroline potassium.
Assalamualaikum and good morning to Madam Ains and fellow classmates. I'm Nora Anna Osman. My metric number is 67. I'm going to present regarding therapeutic of Lorazepam and effect on pharmacodynamics on Lorazepam. Therapeutic usage on Lorazepam. Lorazepam belongs to a class of drugs known as Bezodiapines, which act on the brain and the central nervous system to produce a calming effect. This drug works by enhancing the effect of certain natural chemicals in the body, GABA. It works by slowing activity in the brain to allow for the relaxation. Used to release anxiety. Used to treat irritable bowel syndrome, epilepsy, insomnia, nausea, vomiting from cancer treatment, and to control agitation caused by alcohol withdrawal, as a medication given right after anesthesia, before anesthesia. In this diagram, we can see patient with the benzodiazepine effect able to increase the dopamine activity. Thank you. Pharmacodynamic lorazepam. The effect of lorazepam in GABA receptor produce an increase in the frequency of opening of the chloride ion channel. However, for its effect to generate the neurotransmitter required, anticonvulsant property of lorazepam are thought to be related to the binding to voltage-dependent sodium channel, which the, the sustained and repetitive firings get limited by slow recovery of sodium channel due to the benzodiazepine effect. The effect of lorazepam seems to be very complementary with was observed with different generation of sleepiness and dizziness effect. Mechanism of action. Lorazepam allosteric binds on the benzodiazepine receptor in the postsynaptic GABA, a ligand-gated chloride channel in different side of the central nervous system or CNS. This binding will result in increase on the GABA inhibitory effect, which is translated as increase in the flow of chloride ions into the cell, causing hyperpolarization and stabilization of the cellular plasma membrane. According to the binding site of lorazepam, we can observe different activity as the binding in the amygdala is known to help mainly in anxiety disorder, while the binding in the cerebral cortex helps in seizures disorder. In this diagram, mechanism of action, barbiturate or benzodiazepine goes to bind to GABA and receptor at different allosteric site and then facilitate the GABA action. Barbiturate increase duration and benzodiazepine increase frequency of opening chloride ion channel, membrane hyperpolarization, and then CNS depression. Higher dose of barbiturate can act as GABA mimetic. Thank you. I will pass this presentation to Daniel. Thank you.
Pharmacokinetic lorazepam. Absorption is readily absorbed with an absolute viability of 85% until 90% when given orally. When intramuscularly administered over dose 4 mg, lorazepam is completely and rapidly reabsorbed and achieves a maximum serum concentration of 48 ng or ml in 15 to 30 minutes. When administered orally, the time to attain maximum concentration is observed to be of 2 hours. Lorazepam is hepatically metabolized by CYP450 isoenzyme and extensively conjugated to the 3,0-phenolic glucuronide. This is an inactive metabolite and is eliminated mainly by the kidney. Cytochrome P450 enzymes can be inhibited or induced by drugs, resulting in clinically significant drug-drug interactions that can cause unanticipated adverse reactions or therapeutic failures. Lorazepam is metabolized by the liver to inactive metabolites and is considered the benzodiazepine best tolerated by patients with advanced liver disease. Liver injury from benzodiazepines is probably due to the toxic effects of a orally produced intermediate metabolite. When a single 2 mg oral dose is given to healthy subjects, 88% of the administered dose is recovered in urine and 7% was recovered in feces. From the excreted dose in the urine, the major form is the glucuronide version that represents 74%, while only 0.3% of the dose is recovered as unchanged lorazepam. Adverse effect and side effect of lorazepam. Adverse effect. First one is paradoxical effects. It occurs when taken higher dose than normal, and increased hostility, aggression, angry outbursts, and psychomotor agitation. Second one is suicidal effects. Benzodiazepines are associated with increased risk of suicide, possibly due to disinhibition. Higher dosages appear to confer the greatest risk. Third one is amnestic effects. It occurs when excess sedation given to patient for stage shoulder more than 2 mg, and that is researched to 5 patients on sleep study where there was inject 4 mg lorazepam sedation. Next day evening, most of patients facing memory gaps, or we call it as lost short-term memory. Fourth one is high dose or prolonged parentally administered lorazepam is sometimes associated with propylene glycoprogenin. For example, cause seizures and severe neurological symptoms. Next is side effects. It might be occur dizziness, tiredness, muscle weakness, headache, blurred vision, sleep problems, and loss of balance or coordination.
Assalamualaikum, my name is Nizat Akmal binti Ayub. My matric number is MS20.
I will present about adverse effect and side effect of Lorazepam. Adverse effect, paradoxical effect, occur when taken higher dose than normal, increased hostility, aggression, angry outbursts, and psychomotor agitation. Suicidal effect, benzodiazepines are associated with increased risk of suicide, possibly due to disinhibition. Higher dosage appear to confer the greater risk. Amnesic effect, occur when excess sedation given to patient for sleep, usually more than 2 mg. That is research due to 5 patients on sleep study where there was inject 4 mg lorazepam sedation next day evening. Most of patients facing memory gaps, lost short-term memory. High dose or prolonged parenterally administered lorazepam is sometimes associated with propylene glycol poisoning, cause seizure and several neurological symptoms. Side effect, dizziness, tiredness, muscle weakness, headache, blurred vision, sleep problem, insomnia, loss of balance or coordination. Contraindication, allergic or hypersensitivity, respiratory failure, acute intoxication, ataxia, acute neuro, sleep apnea, myasthenia gravis, pregnancy and breastfeeding, overdose, mental confusion, dysertia, paradoxical reaction, drowsiness, hypotonia, ataxia, hypotension, hypnotic state, coma, cardiovascular depression, respiratory depression, death. Chemical taxonomy lorazepam. Description: this compound belongs to the class of organic compound known as 1,4-benzodiazepine. These are organic compound containing a benzene ring fused to a 1,4-azepine. Kingdom: organic compound. Superclass: organoheterocyclic compound. Class: benzodiazepine. Subclass: 1,4-benzodiazepine. Direct parent: 1,4-benzodiazepine. Alternative parent: alpha amino acid and derivative, chlorobenzene, aryl chlorides or others. Substitute: 1,4-benzodiazepine, alkanolamine, alpha amino acid or derivative, and others. Molecular framework: aromatic heteropolycyclic compound. I will pass this presentation to Lutfi. Thank you.
My name is Muhammad Lafi Hadi bin Muhammad Yusuf. I'm from Group Jabal Al-Hayyan. My matric number is MS17. I'm going to talk about treatment. A specific treatment to reverse the effects of lorazepam does exist. This medicine, called flumazenil, can reverse the effect of lorazepam, but must be given through an IV at a hospital. Only a doctor can decide if you need this medication.
So now I'm going with question. The first question is, what is the danger of overdose with class of medication? And the answer is, the danger of overdose with class of medication is mental confusion, dyspepsia, paradoxical reaction, drowsiness, hypotonia, ataxia, hypotension, hypotonic state, coma, cardiovascular depression, respiratory depression, and the last one is a death. From this, that we are not any side effect of medicine will affect our mental first. The second question: what is the cellular mechanism of action of this class of medication? And the answer is, the cellular mechanism of action of this class of medication is lorazepam electrostatic bind on the benzodiazepine receptor in the postsynaptic GABA A region gated chloride channel in different sites of the central nervous system. So, in our body, the main thing is the central nervous system. So, if any effect will be had on central nervous system. And the last question: what pharmacologic agent can be used to treat this patient, and what is the mechanism of action? To treatment that can be used for this patient is flumazenil. The mechanism of this action is it can reverse of the effect of lorazepam it will given through the IV at the hospital. Thank you.
For conclusion, the drugs Lorazepam that consumed by patient react due overdose and also interrupt with alcohol, food or caffeine that patient consume during night. Lorazepam misuse can be reversed if patient seek treatment as soon as possible and knowing the actual dose taken by patient. The detailed attempt suicide normal can be obtained by hospital through QA, question answer, or CE. I will pass this presentation to Rashida. Thank you.